Hi everyone, and welcome to Unit 6, where we're going to talk about the anaerobes. We're going to talk about some of the anaerobes that are gram-positive today, including the gram-positive cocci, which are the Peptostreptococcus, and the gram-positive rods with spores, which are the Clostridium species. All right, before we get too far in this lecture, you do need to know some terms. So the first term is anaerobe, and this is an organism that requires little oxygen. It won't grow with oxygen or CO2. Then you have obligate anaerobe, which is an organism that cannot tolerate any oxygen whatsoever. Then we have aerotolerant anaerobe, which can tolerate a very small amount of oxygen. It prefers no oxygen, but can tolerate a little bit. A facultative anaerobe is one that grows equally well under aerobic or anaerobic conditions. Some facultative anaerobes would be Staphylococcus and Enterics. And then we have the microaerophilic organisms, which are organisms that grow best in 5% oxygen, 10% CO2, and 85% nitrogen gas. Just keep in mind that room or ambient atmosphere is about 21% oxygen. So anaerobes are completely normal in some body sites, including the gastrointestinal tract, especially the colon. In fact, anaerobes outnumber the aerobes 1,000 to 1 in the colon. The oral cavity, especially near the gum line. Anaerobes are also normal in the vagina and on the skin. Intact body surfaces prevent these anaerobes from entering healthy tissues, and multiplication of these organisms is inhibited unless the surface of the skin is damaged. Some anaerobes that are normal flora in the mouth would be things like Bacteroides, Fusobacterium, Peptostreptococcus, and Veillonella. They are gram-negative rods, gram-positive cocci, and a gram-negative cocci, respectively. We also have anaerobes that are normal in the upper respiratory tract, including the nares and the gums. And that would be things like Actinomyces, Bacteroides, Eubacterium, Cutibacterium. The old name for that is Propionibacterium, but the new name is Cutibacterium, Fusobacterium, Peptostreptococcus, and Veillonella. So we have a mixture of normal anaerobic flora in the nares and in the gums. Anaerobes can also be normal flora of the bowel or colon. This would include organisms such as Bacteroides, Clostridium, Bifidobacterium, Fusobacterium, Eubacterium, and then other miscellaneous gram-positive rods that are anaerobes, including diphtheroids and lactobacillus. Anaerobes are normal flora of the vagina, including Bacteroides, anaerobic lactobacillus, Clostridium, Peptostreptococcus, and miscellaneous gram-positive rods such as diphtheroids, and also Mobiluncus. Then we have normal anaerobic flora of the skin, which would include Cutibacterium and Peptostreptococcus. There's a number of common infections that are associated with anaerobes, and that would include things such as brain abscesses, periodontal infections, sinusitis, lung abscesses, liver abscesses, abdominal infections, perirectal abscesses, and vascular infections. Those are all common sites for getting anaerobic infections. Here I have a list of the gram-positive anaerobes. Some of these are gram-positive rods, others are gram-positive cocci. Pretty much the entire list here are gram-positive rods except for Peptostreptococcus, which is a gram-positive cocci. One thing that's fun about gram-positive anaerobic rods is that they have really interesting morphologies on the gram stain. For example, Actinomyces is a branching gram-positive rod. Clostridium is a gram-positive rod that's either seen as boxcars or seen with spores. We have Cutibacterium acnes that kind of looks like a boomerang. We have anaerobic lactobacillus, Peptostreptococcus, and that's our anaerobic gram-positive cocci. Bifidobacterium, they kind of look like dog bones. They're gram-positive rods. And then Eubacterium. So these are all gram-positive anaerobes. Pictured here on the left, we've got an example of lactobacillus, which is a chaining, long, skinny gram-positive rod. Sometimes they can get a little curlicue on the end. On the top right, we've got Peptostreptococcus, which is just kind of a tiny gram-positive cocci in chains. And then the other The other picture on the bottom left is an example of actinomyces, which is a branching gram-positive rod. And then the image on the bottom right, you can kind of see spores. That's an example of a Clostridium. We have both internal and external factors that contribute to anaerobic infection. The internal factors are called endogenous factors, and the external factors are called the exogenous factors. In internal factors that contribute to an anaerobic infection, on the list we have abscesses that have kind of gone bad. We've got complications of appendicitis. Usually that is peritonitis from a ruptured appendix. We have periodontal procedures, septic arthritis, sinusitis, and osteomyelitis. Those can all lead to anaerobic infections. External factors or exogenous factors that lead to anaerobic infection would include things like foodborne toxins. Those would be toxins from Clostridium botulinum or Clostridium perfringens. That would be the botulinum toxin. We have gas gangrene spores from the environment. Gas gangrene is caused by Clostridium perfringens, or you could have tetanus, and tetanus is caused by Clostridium tetani. And then we have animal or human bites. Those can often lead to anaerobic infections as well. There's a number of clinical signs that would indicate we have an anaerobic infection or that we're dealing with an anaerobic infection. One clinical sign is that the patient has a foul-smelling wound drainage. This may be your first indication of anaerobes. Oftentimes you can smell the anaerobes before you can see them growing. If your patient has necrotic tissue, which is dead, dying, or black tissue, that could indicate an anaerobic infection. If they have gas in the tissues, this is indicated by bubbling areas of the tissues. This could indicate an anaerobic infection. Okay? An infection following a bite often leads to anaerobic infections. The presence of sulfur granules, and you can see a picture of a sulfur granule on the right. This is an example of a sulfur granule in lung tissue. They're called sulfur granules because of its resemblance to elemental sulfur, and it is associated with actinomyces. And then we have exudates that will fluoresce under a UV light, and they'll fluoresce either red or green, indicating that your patient has a Prevotella or Porphyromonas or Veillonella infection, or if they fluoresce green, it's possible your patient has a Fusobacterium infection. Other bacteriological clues or clues that indicate the presence of anaerobes would be things like the gram stain morphology. Some of the most unusual and visually interesting organisms on the gram stain are anaerobes. If you have organisms that are seen on the gram stain but fail to grow aerobically, this could indicate an anaerobic infection. This is especially true in respiratory samples like sputums, where you see mouth flora that are gram negatives but they fail to grow on your aerobic media. You could have growth in the anaerobic zone of a broth media such as thioglycolate. If you have growth at the bottom of your broth, it probably indicates you're dealing with an anaerobe. If you have gas or a foul odor in a specimen on culture, it could indicate the presence of anaerobes. If you have characteristic colonies on anaerobic plates or macroscopic clues such as a ground glass appearance or black colored colonies, this could indicate anaerobes. And then finally, if you do aerotolerance tests where you put your organism on chocolate aerobically and then you put your bug on an anaerobic blood agar or anaerobic Brucella agar, if you only have growth on the anaerobic plate, it indicates that you're dealing with an anaerobe. To identify anaerobes, the first thing we want to do is perform an aerotolerance test. We want to take our organism and put it on an aerobic chocolate agar and then an anaerobic blood or Brucella agar and see where it grows. If it only grows on the anaerobic plates, that it stands to reason that we're dealing with an anaerobe. Then we want to describe the macroscopic colony, including hemolysis, pigment, and how it adheres to the agar. This could indicate you're dealing with an anaerobe. You can fluoresce the organisms with UV light. If you have organisms that fluoresce bright green or brick red, it probably means you have an anaerobe. You could do the catalase test, only it's best to require 15% H2O2 to do these tests. You could also perform spot indoles on non-sporing gram-positive rods that could indicate, if it's positive, that you're dealing with the Cutibacterium acnes. You can also determine vancomycin and SPS sensitivity on all gram-positives, especially if you have a gram-positive cocci. If you have a Peptostreptococcus, it's going to be resistant for SPS. If you have a Peptococcus niger, it's going to be sensitive for SPS. For gram-negatives, always determine the tolerance to bile salts, nitrate reduction, kanamycin, and vancomycin sensitivities. Okay. If you have a spore-forming gram-positive rod, look at your lipase and lecithinase activity. Lipase and lecithinase activity on a media known as egg yolk agar will help us speciate the Clostridiums. There's a couple different types of plates and broths that we can use to better isolate growing anaerobes. For example, plate media that's good for anaerobes would be anaerobic blood agar or Brucella agar. And Brucella agar is basically blood agar, only it contains vitamin K and hemin, which helps the growth of anaerobes. In broths, we could have thioglycolate, which also has hemin and vitamin K, which is good for anaerobes. Or we could use cooked meat broth or chopped meat broth, and these meat broths contain beef heart, hemin, and vitamin K, which again is going to support the growth of anaerobes. There are certain types of specimens that are always going to be cultured for anaerobes, and some of those specimens would include sterile body fluids, deep wounds, lung aspirates and biopsies, and brain tissue. All of these types of specimens would dictate that you have an anaerobic plate set up on these types of cultures. So for these types of cultures, you would set up a blood agar with CO2 and then also a blood agar or Brucella agar anaerobically. This media must be pre-reduced, and what I mean by that is you must take these plates, and before you culture anything on the plate, you have to remove the oxygen prior to culture. We do that by putting all of our plates in a jar with an anaerobic satchel that creates an anaerobic environment, and it actually takes the oxygen out of the media or pre-reduces them prior to use. We're going to have a chocolate agar with CO2, a MAC agar aerobically, and then finally the last broth that we're going to set for anaerobes would be a thio or chopped meat broth, and those support the growth of anaerobes. Okay. There are some specimens that are not suitable for anaerobic culture, and those would include things like stools, clean catch or catheterized urines, upper respiratory samples such as sputums, throats, or mouths, and then superficial wounds. Those would be wounds of the skin. And then also vaginals. Vaginal cultures would not be appropriate for anaerobic culture either. The reason stools, urines, respiratory samples, superficial wounds, and vaginals are not suitable for anaerobic culture is because they all grow anaerobes as normal flora. There's a number of secondary medias that we can use for anaerobic subculture, and they're used for a variety of different reasons. We can use kanamycin, vancomycin agar to identify certain gram-negative anaerobes like Prevotella or Bacteroides. We can use phenylethyl alcohol agar or an anaerobic PEA for the isolation of anaerobic gram-positive organisms. We can use egg yolk agar, also known as McClung tobe, to speciate Clostridiums. Egg yolk agar demonstrates the production of lipase or lecithinase in those organisms. We can use kanamycin bile-esculin agar, which is good for the identification of Bacteroides, and we can use low kanamycin vancomycin agar for the identification of Prevotella. And then finally, we can use a litmus milk broth that evaluates lactose and casein digestion. Now, in order to isolate anaerobes optimally, we have to make sure that the specimen is of acceptable quality. Is the specimen okay for anaerobic culture? We have to have the proper collection and transport of these specimens. We want to make sure that our specimen is collected and transported under anaerobic conditions. We want to rapidly process the specimen. We don't want any prolonged exposure to oxygen. And finally, we want to make sure that we're using the correct culture technique in the micro lab. In other words, we want to make sure to use the correct media, correct incubation atmospheres, and correct incubation time lengths. For example, if we're trying to grow out actinomyces, we'd want to make sure that that plate is in an anaerobic environment for 5 days. So just to recap, there are specimens that are acceptable for anaerobic culture and specimens that are unacceptable because anaerobes are part of the normal flora. Acceptable specimens for anaerobic culture would include sterile body fluids and blood, deep abscess material, deep tissues, transtracheal aspirates and lung aspirates, and biopsies. Unacceptable means that the organisms on this list have anaerobes as normal flora, and that would include things like throat, sputums, and bronchs, fecal material, clean catch or catheterized urines, vaginal or endocervical swabs, and superficial wounds. We want to make sure that if we are collecting a specimen for anaerobic culture that we don't use swabs. It's best to get a needle aspirate of the wound or the exudate that we're trying to culture. We do want to use special anaerobic transport systems where we take the swab and put it down into an anaerobic container, and that's going to help support the growth of anaerobes. And we do want to process these specimens rapidly in order to not expose them to oxygen for very long. Some of the most interesting gram stains are anaerobes, and there's several clues that you're probably going to be dealing with an anaerobe on the gram stain. Okay, so if visualizing the gram stain demonstrates pale or unevenly stained gram-negative rods, you could be dealing with a Clostridium. If you have pleomorphic bacteria or pleomorphic gram-negative rods, you could be dealing with the Prevotella. If you have an organism that has filamentous or tapered ends, that could be a Fusobacterium. In fact, the word fusiform means needle-like. Okay? If you have thicker gram-positive rods with or without spores, you could be dealing with a Clostridium, possibly a Clostridium perfringens that shows boxcar gram-positive rods. If you see thick gram-positive rods that are short in chains, branching or bifurcated, that could be an actinomyces, that could be a bifidobacterium, it could be one of those miscellaneous gram-positive rods. And then finally, if you have very teeny tiny gram-negative cocci or gram-positive cocci in chains, you're probably dealing with either a Veillonella or a Peptostreptococcus. Over on the image on the left-hand side, you can see dog bones, and those dog bones represent bifidobacterium. This is what we call bifurcated gram-positive rods. For the identification of anaerobic gram-positive cocci, we may notice that they are gram-positive cocci if you have darkly pigmented colonies that are SPS resistant and the indole is negative. That's possible that you're dealing with an anaerobic gram-positive cocci. They may actually stain gram-negative because they are fragile and they will autolyse. It's always a good idea to set up a vancomycin test, and that helps us determine if we're dealing with gram-positive organisms because gram-positive bugs are almost always sensitive to vancomycin. We can use an SPS disc to differentiate whether we have Peptostreptococcus, which is SPS sensitive, or Peptococcus niger, which is SPS resistant. Some old Peptostreptococcus are asaccharolytic and are indole positive, but most aren't speciated. Most of the time, if we have a non-pigmented SPS sensitive gram-positive cocci, we're going to call that Peptostreptococcus. Okay? Now, indole testing may be helpful if you're trying to identify Cutibacterium acnes, or if you're trying to rule out Cutibacterium acnes. It's a gram-positive rod. And then you want to observe macroscopic pigments of colonies. If you have colonies that start to turn black, it is possible that you have Peptostreptococcus niger, Peptococcus niger. Okay? Remember that SPS stands for sodium polyanethol sulfonate, and it's used to differentiate Peptostreptococcus and Peptococcus niger. Here I want to outline anaerobic gram-positive rods with spores. So Clostridium species all have obvious spores except for Clostridium perfringens. Clostridium perfringens can be a boxcar gram-positive rod, and it's difficult to get it to make spores. Please note the location of the spores whenever you're observing a Clostridium. Are they terminal spores, like in the case of Clostridium tetani, or are they subterminal spores? Usually the subterminal spore in the middle of the cell body is a little bit less obvious and sometimes less bulbous. Usually there's no need to speciate Clostridiums. However, in sterile body fluids we would. It can be speciated though using lipase and lecithinase information. Also, gram-positive rods that are Clostridiums tend to over-decolorize very easily, but even if you see a gram-negative organism with the spore, it's probably going to be a Clostridium. Most of our gram-positive rods with spores are motile, however, not Clostridium perfringens or Clostridium ramosum. They are both non-motile. So here I have some pictures of Clostridiums. In the top row, basically both images on the top row are the boxcar gram-positive rods, which is associated with Clostridium perfringens. And then the bottom row is our Clostridiums that have spores. Those could be Clostridium sporogenes or Clostridium tetani. Both of those produce spores. Here's a nice chart for speciating the Clostridiums. These are the gram-positive rods with spores. Again, we want to locate on the organism if it has a spore or not, and then we want to determine is the spore subterminal or terminal. Okay, we can also use lipase and lecithinase to further speciate our Clostridium. We can use litmus milk, glucose fermentation, and indole testing to identify these different species of Clostridium. Egg yolk agar helps us speciate Clostridium. We can determine what species Clostridium is by looking at whether or not they produce lipase or lecithinase, or if they do not produce lipase or lecithinase. Lipase enzyme is basically the production of oils or fatty acids by some bacteria, and then we have lecithinase, which is bacterial lecithinase that break down lecithin to insoluble diglycerides, resulting in an opaque halo around the colony in egg yolk agar. You can see on egg yolk agar that organisms that are lipase positive, if you look at that image on the bottom left, they appear to have kind of an oily consistency, and they can have what's known as a mother of pearl sheen, where they look like the inside of a seashell, where they're kind of pinkish or kind of purplish, but they definitely have an opulence to them. And then lecithinase, if you have an organism that produces lecithinase, what you will see is a precipitate around the colonies, and you can see that in the bottom right image. Let's go ahead and talk about some diseases associated with Clostridium. The first one I want to talk about is gas gangrene, and this is caused by Clostridium perfringens. Clostridium perfringens is found in the gastrointestinal tract of mammals and also in the environment and in the soil. One of the virulence factors of Clostridium perfringens is an exotoxin known as perfringolysin O, and this allows the organism to elude macrophages. Gas gangrene usually has a rapid onset, and there is pain and swelling at the infection site. There is gas in the tissues that you can hear. You can hear crackling in the tissues when you push down on them, and that's because of the gas production. People that have gas gangrene may develop toxic delirium and go into a coma, or they also may develop septicemia and renal failure. On the gram stain, we're looking for gram-positive rods with no spores. They make spores, but it's difficult to get them to be visualized. But we're going to look for boxcar gram-positive rods, and macroscopically, we're going to look for a double zone of beta hemolysis. Botulism is a disease associated with foodborne illnesses, wound illnesses, and also in babies. Botulism is actually the Latin word for sausage, and it can be found normally in the environment, especially in the soil. Clostridium botulinum is a gram-positive rod with spores, and it produces foodborne toxins such as the neurotoxin found in canned green beans, canned fish, or canned mushrooms. This neurotoxin gets into wounds. The spores actually cause our person to get sick. We have wound botulism, and then we have infant botulism, which is associated with honey and corn syrup. So kids under the age of 1 should not eat raw honey or anything that has corn syrup in it. Okay, the incubation period for botulism to onset is about 2 to 8 days after exposure. And then there are some toxic effects to nerve endings because of that botulinum toxin. You probably are familiar with Botox, and Botox actually stops muscle contraction. So the botulinum toxin is the most potent neurotoxin known to man, and it is commercially used for taking wrinkles out of a person's face or to be used to relax certain muscle contractions. Tetanus is also referred to as lockjaw, and this is from Clostridium tetani, and Clostridium tetani is found in the soil. Okay, the reason it is called lockjaw, and you can see that child there on the upper right has lockjaw, and that's because he has a stiff neck and arm stiffness and convulsions, and this is the result of a neurotoxin. Tetanus produces the second most potent neurotoxin known to man. It is a gram-positive rod with round terminal spores, and it's transmitted by puncture wounds, nails, or traumatic body penetration from gunshots or splinters or something like that. But it does enter the body by skin penetration. The incubation period is about 2 days to several weeks, and it does produce the second most potent neurotoxin, and it can move from the wound to the brain via the bloodstream. This is actually able to be treated with an antitoxin. Then finally, I want to talk about everybody's favorite organism, which is Clostridioides difficile. The old name was Clostridium difficile, but the new name is called Clostridioides. Okay, this is associated with diarrhea and enterocolitis, also known as pseudomembranous colitis. Clostridioides difficile is normal in the soil and in the water and in the intestinal tract of some populations. It's a gram-positive rod with subterminal spores, and macroscopically it looks flat and spreading, rhizoid with internal speckling. It does have that ground glass appearance. It may not be easy to grow on culture, and often it is diagnosed serologically by looking for the toxins that it produces. Clostridioides difficile produces 2 toxins known as toxin A and toxin B. Toxin A is associated with fluid accumulation, and toxin B is associated with tissue destruction. Like I said, Clostridioides difficile can be difficult to culture, but if you did want to try, you could put it on a media known as CCFA, which is selective for Clostridioides difficile. CCFA media stands for cycloserine sulfoxetine fructose agar. And so you could try to culture it on CCFA media, but it's actually best to diagnose it through identifying the toxins A and B. So that's it. That's our lecture on gram-positive cocci and gram-positive rods that are anaerobes. So stay tuned for Unit 7.